News Channel 5 Network, this is Health and Today's Woman with your host, Dr. Kelly Williams. Sponsored by Murfreesboro Medical Clinic.
Welcome to Health and Today's Woman. I'm your host, Dr. Kelly Williams. As always, this show is designed to help women become champions of their own health care. Tonight we're going to take on a topic that lately has gotten a lot of attention in the media, and that's the idea of hip replacement surgery. Now, recently, having had a family member go through this, I'm especially interested in learning more about this procedure, who can be helped, and what some of the expectations are that we should have of this procedure. To help me better understand this, I've invited Dr. Matt Barrett. He is a joint replacement specialist at Tennessee Orthopedics Alliance at Middle Tennessee Medical Center. So I want to start off by saying, Matt, thank you for being willing to be here.
Thanks, Kelly.
Now, something that's a little bit interesting about you, and I want to kind of start here, is you're trained differently than a normal orthopedist. So I want you to tell me a little bit about what makes you different than the normal orthopedist.
Well, like all orthopedists, we do a 5-year residency in orthopedics. But I had a special interest in hip and knee replacement. So after that residency, I did a fellowship in joint replacement up in Washington, D.C.
Okay, and that makes it a little bit, you spent your whole time in that year just learning how to do special joint replacements, is that correct?
Exactly.
And I know that's one of the things that makes you a little bit different is you kind of get the toughest cases because a lot of people want somebody that's specialized in this area, is that right?
Correct, and the redo type cases are the more difficult cases. That's something I also take a special interest in.
Good, because I want people to realize that as they start looking, I want them to understand that there are these specialists out there that are available if they so choose. Now, I want you to, we're going to put a billboard up here. People don't realize the actual number of procedures that are done. This is 120,000 hip replacements per year. So this is something that's done quite often. But I want you to start off with, you know, who needs this? How do we begin to start understanding patients with joint problems? What type of symptoms are they going to notice to say, you know what, I might have a joint issue?
Well, typically you will have pain localized to the hip area or to the knee area. Sometimes you self-refer yourself to the doctor. Sometimes your family members tell you you need to go to the doctor for it. Sometimes your primary care doctor will tell you. But typically you have pain localized to the hip or the knee, and then that causes you to seek treatment, and ultimately some of those people will wind up needing a joint replacement.
Now, not all of them, and I think that's important. Not everybody's going to end up needing joint replacement, is that correct?
Correct.
And so, you know, what are some of the other options other than surgical options that these patients may see before they ever get there?
Well, surgery is always a last resort. You start off with non-surgical things, and that's things like activity modifications. So if you know you're running excessively, you may have to change. You may have to start cross-training or things like that. So activity modification to start. Things like braces sometimes are helpful with knees, for instance. Medications are helpful, and we often give patients anti-inflammatories to help with arthritis pain. Injections can sometimes be helpful, and we can do those in the hip or the knee. So there are lots of things that we try prior to surgery. Surgery is the last resort. Now,
a lot of people see orthopedic surgeon, as I always say. It's kind of a, you know, obviously you're going to operate because you're an orthopedic surgeon. When do they need to come see you? Do they start at you or do they start at their primary care?
I think either way. You know, quite often patients will start at their primary care doctor, and then they'll be referred on to an orthopedic doctor after things like medicines fail. But orthopedists will treat patients non-surgically as well as surgically.
That's really important because I don't think a lot of people do realize that this is, orthopedic surgery does both non-surgical as well as surgical treatment. And I think that's really important to address it. You don't necessarily have to go to your primary care, although you can follow up with an orthopedist who is specialized in this area, who doesn't always do surgery, because I think that's something that's very important. Now we're going to turn here for a second because I want to look at some x-rays that we have, and I want to show you, get you to explain a little bit about these x-rays. And of course right now we've got a normal x-ray. Explain this x-ray a little bit to me so people can kind of understand what they're looking at when their doctor shows them this.
So this is a hip x-ray, and the hip is a ball and a socket. And you can see the ball there, and the socket is that little white line above the ball. And there's some space between the white line and the edge of the ball. and that space is cartilage.
Mm-hmm.
And so this is a normal hip x-ray.
Okay. Well, now I want to go to the next one, because now we're going to have one that's a little bit, it's obviously different. And this is severe. DJD stands for degenerative joint disease. So this is severe degenerative joint disease. Describe this one to me.
So the big difference here is you don't see that space between the edge of the ball and the socket. So that white line that was the socket is touching the edge of the ball. So there's no more cushion in this hip joint.
Okay, now we're going to go and look at normal again. This is a little different x-ray. You can again see that white line you're talking about. Describe this one to me. It's just a little different look at it.
A little bit different view, but again, the ball is there, and then there's a space, and then there's the white line, which is the socket, and so there's some cartilage between the ball and the socket in that x-ray.
Okay, then we're going to go to this next one. This is that same x-ray, or same view, just a different patient. Again, severe degenerative joint disease. Describe to me what's going on here.
And these are similar findings here. You again do not have a space between the ball and the socket, so all of the cartilage is gone in this hip.
And that's what's causing them pain.
Correct.
And that's going to make it also a decrease in their motion, is that correct? Because they can't move that hip as well?
Correct.
Okay. We're going to take a break right now. We'll be right back. When we come back, we're going to talk a little bit more about how to fix that x-ray that I showed you just a second ago. We'll be right back after these messages.